and welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Kara Mobley, and on today's episode, we are going to be talking about the Wound Healing Center in Henry County in Paris, Tennessee. On my episode today, as my guest, I have Sonya Clark. Welcome to the show, Sonya.
Hi, how are you?
I'm good. How are you?
Good.
So what is your role at Henry County? Is it Henry County Medical Center?
It's West Tennessee Healthcare Henry County Hospital, and I am the clinical manager for the Center for Wound Healing.
Great. So how long has that center been there?
So we have had a wound clinic at Henry County Medical Center for over 20 years. But we expanded and developed the Center for Wound Healing about 5 years ago. Okay. And so we expanded all of our services and brought in 2 medical providers, and we just offer a lot more services now.
Great. And so how did you get into that role and get involved with Henry County? Because I know West Tennessee Healthcare recently took them over, but I wanted to ask you kind of how you got into this field and how you got that position.
Well, I am a registered nurse, and I worked at Vanderbilt University as a trauma nurse. Oh. And I decided years ago, a long time ago, that I wanted to be a wound ostomy continence nurse. So I got my certification in wound ostomy continence care and moved back home. Paris, Tennessee is my home. And when I got a job at Henry County Medical Center as their wound ostomy continence nurse and developed the wound clinic there. And then it just evolved into the Center for Wound Healing 5 years ago when we expanded our program.
Right. And that's through the hospital now.
Yes.
So how does the Wound Healing Center in Paris play a role in the community?
Well, our goal is to make sure that patients in Henry County and all the surrounding counties have access to good quality medical care. And a lot of patients don't have the ability to travel to Jackson or Nashville or Memphis to a wound clinic. And there's just a huge need for that in our area. Right. So that's when the wound clinic was developed. And then as it grew, we expanded it because there is just such a need for patients to be able to get their care locally.
Right. And so what types of wounds does that center specialize in treating?
Well, if it's a wound, we'll take care of it. Right. I will tell you, we take care of every kind of wound. It may be a diabetic wound. It may be a wound from circulation problems like a venous wound or an arterial wound. We take care of patients that have neuropathy and they have wounds from that. Then we have surgical wounds, that patients that won't heal, or surgical wounds that are left open. We have burns that we take care of.
I didn't even think about burns.
We have abscesses. We have even some strange type wounds like hydradenitis or pyoderma, which are a lot more complicated. We do take care of some of those, but we'll take care of anything from road rash, like if a patient has had a motorcycle accident or a bicycle accident, a child with an abscess on their leg, maybe they got injured and now it's infected. We pretty much take care of anything that's open.
Right, yeah. Mm-hmm. So that might have answered part of this, which was why do some wounds require specialized care instead of healing on their own?
Well, every wound needs some kind of care. If you scrape your hand at home, you're going to do some kind of care to that wound. You're going to wash it. You're going to clean it. You're going to put something on it. But sometimes we just need more care. I guess the example I would give is you might have high blood pressure, and for a while you might be able to manage it with diet, but at some point you need extra care. You may need medication. You may need something else. So a lot of times as we get older, our wounds don't heal as quickly, so we need extra care, or you may have a medical problem that prevents that from healing.
Right.
That will make your healing slower, which can cause more complications in the future if you don't go ahead and get that healed.
Right. I would assume maybe like infections or things like that.
Infections or pain.
I was going to say the mobility of just trying to live with that. They're having trouble walking because their wound hurts so badly. Right.
Or they just can't live with how it's draining or the odor or the pain. You know, those things can alter their quality of life.
Right.
And we want our patients to have a good quality of life.
Exactly. One question that I thought of in the middle of that. So if you have just like your own, you scratch yourself or you bump into something and you've got a kind of an open wound, is it better to leave it like covered with like Vaseline or something, or should you let it like dry out? Because I've heard people say, oh, you got to let it air out.
So one of the biggest misconceptions with wound care is air will heal.
Right. I heard that all growing up.
Right. Well, if air would heal, I would bottle it and sell it, and then I would be a millionaire.
Right.
Air doesn't heal things.
Right.
Now, sometimes we do let a wound have a little bit more air. Mm-hmm. Sometimes we do decide to do that, but really that is more of a medical decision. If you are leaving something open to air, just remember you're also leaving it open to get any kind of germs in it.
Right.
So if someone besides you coughs, you could get germs in it. Yeah. If you touch it with something or it gets touched with something that has germs in it, that is actually more dangerous. So we do want you to clean your wound and then usually cover it with something.
Yeah, because it almost seems like just to like a layperson, in their own mind, it's like covering it up doesn't let it breathe. Like it's almost like just in your mind, you're thinking, I gotta let this breathe. Right. But yeah, so it's kind of like counterintuitive to say cover it up and leave like Vaseline or something. Right. Covering it.
And sometimes we'll have you at least cover it up while you're doing something outside.
Oh, exactly.
Or if you're going to be in public around other people.
Yeah.
And then if you're really sure that you just have to let it be open, do that more at home when you're not going to be exposed to any more germs.
Yeah. Because that was just something I had always thought about that you touched on. Mm-hmm. So what are some advanced treatments and technologies that are available at the center there in Paris?
So we do lots of different treatments. We do antimicrobial treatments or silver type dressings. We do total contact casting, which is a special cast to take the pressure off of a patient's wound so that they can continue to walk. We do some types of skin substitutes, which is like a skin graft, but we can do them right there in the clinic. Okay. We do debridements, of course, surgical debridements, and cleaning up the wound basically and getting all of the unhealthy parts out of the wound so that it will heal faster. We also offer cultures to make sure that patient doesn't have an infection, because sometimes you don't show that you have an infection even though you don't look like you have an infection. You could still have one, and that could be preventing you from healing.
And having that knowledge, knowing there's no infection, or yes there is, we need to
treat it and take care of it.
And that kind of brings me to the question of, how does the center take a comprehensive approach to care, considering factors, like you said, diabetes, circulation, and infection prevention?
Well, our medical providers do a comprehensive history when the patient arrives, and then they look to see, based on the patient's history and how long they've had the wound, what do they think is causing this wound not to heal. Now, one of the misconceptions out there is if you go to a wound clinic, you cannot have home health nurses, and that's not true. Oh, okay. We work with home health agencies to make recommendations for what they should do for the wound so that the wound can heal faster. Right. We work with vascular doctors and surgeons and dermatologists to try to make sure that those patients are getting the care that they need so that they can heal faster.
Right. Yeah. And that kind of brings me to this question, which is, what's the typical patient journey when they come to the wound healing center? Like you mentioned, it's the length of time. Is there a typical, you go in this many times a week or for this amount of time, or it's kind of probably based on the person?
Well, first, at our wound center, we don't require referral unless their insurance requires a referral. Okay. So there are some insurances, for example, VA requires a referral, but most insurances don't. So the patient can just call if they need to be seen. We will set them up an appointment. They will come in and we'll do a pretty comprehensive history. So the first visit's probably going to be 45 minutes to an hour that they will be there with our nurses and with our providers.
Yeah, getting set up and learning,
We take pictures of the wounds. We do measurements to see how those are going to progress over time. And then it just kind of depends on the wound. If the provider thinks that the patient needs more care, then they may come 2 or 3 times a week. But if the patient is able to take care of themselves some at home, then we may just see them once a week.
Right. Mm-hmm. And so do you have any memorable success stories of patients who have overcome any kind of severe wound challenges for you?
I have lots of success stories. we all have our patients that are pretty special to our
Right,
heart.
yeah.
And I do have one patient that has been just a special part of our lives for a while. She had a major surgery and was in the hospital for a while and was left with a very large wound on her abdomen. She went home and unfortunately developed some infections and problems that she didn't know she had. And her primary doctor referred her to us. And when she got to us, I think it was just too overwhelming for the family. The patient was in a lot of pain. They didn't have the supplies they needed to take care of her at home because, in smaller towns, you can't just go and buy the supplies you need.
And especially, the expense and everything.
Right. And they just didn't have what they needed to be able to take care. And we helped her through this, made sure that she could get better so that she could get back to see her surgeon at some point. And then she has since made an amazing recovery and healed. And then she comes back and visits us.
Oh, that's great.
And we see her out in public. And it's just very nice to know that we helped her.
And that's always great in professions like that where, you're doing something that a lot of people wouldn't be able to do, that this is a highly specialized field. And having the success stories and meeting the people and getting to know them, I would imagine is a very rewarding part of that job.
It is very rewarding, and especially when you can see them out in the community and going on and leading a good quality life now. I mean, she is doing great and enjoying life again and can go on vacations.
Exactly, yeah. And so that kind of brings me to a question of, how do you guys help patients who have been struggling with wounds for, months or even years, if they come to you and they're kind of just overwhelmed and exhausted with something that they've had for a long time?
It can be very scary to go home from the hospital with a wound. I personally have had an open wound on my abdomen. And even as a nurse, I was intimidated and scared when I went home. Yeah. And you have to have, you hope you have family support.
Right.
But even with that, you don't always have, like I said, the dressings and supplies that you need. So we just want those patients to know they have somewhere to call. They have someone to be able to call if they have pain or if they think they're getting an infection.
Yeah, they have a question, I guess.
Complication. So, and we can arrange for home health if that patient still can't come into the clinic. So,
right, yeah. So, I know you mentioned a few of the misconceptions, but are there any other ones that I haven't asked you about that you get a lot? Like people maybe come in and are
yes.
This is a big one that you get a lot.
Yes. Please don't pour peroxide on every wound.
That is something my parents did to every paper cut, every scrape I ever had.
That's what I did. That's what my parents did also. Peroxide got poured on everything, and then we used other things that we just won't even mention at the time.
Yeah.
But if you just feel like it's necessary, you've been injured in the yard, like doing yard work, if you want to put peroxide on it one time and that makes you feel better, that's good. And then after that, stop.
Because I would assume it's like dry. It dries it out.
It kills good things and bad things.
Oh, it just kills everything.
So
yeah.
I tell people it doesn't have a brain. Hydrogen peroxide does not know the difference between good and bad.
Yeah.
So it kills both. So you want to stop it at that point and then just do your soap and water until you
That's what I used to do, but it's like now if I get a paper cut, I just do soap and water, and I'm like, I think I'm good with this. Just put a little Vaseline on it, put a Band-Aid on it. So what would some signs be for someone to look for if they needed to get specialized wound care? I guess this would be, if you hurt yourself and now you're like, oh no, this is maybe not healing on its own.
Generally, if you have a wound, you should be healing or healed in 2 weeks.
Okay,
if you're a healthy
person.
So if you have not healed in 2 weeks, it's time to start seeking medical treatment. Yeah. Or if you're showing signs of an infection, increase in pain, or something's just getting larger and not doing well. And that is if you're a healthy person. If you are a diabetic, and you get a wound, you should make an appointment to either see your primary doctor or a wound care center immediately. Because the sooner you get in to see someone, the faster you're going to heal eventually.
Right.
If you sit at home and you think, this is going to heal, I've always healed fine, and 3 or 4 weeks later you decide to finally see a doctor, then you've just delayed your healing that much longer.
Right. And I know there's a lot of, especially with diabetes, that's a big thing with wounds, not to wait on that.
Right. It's just dangerous. You need to get seen as soon as possible.
Right. And so with your center there in Henry County, you did kind of touch on this, and it's how does the center work with local doctors, hospitals, and nursing homes to improve wound care access? Because I wanted to ask you maybe about the nursing home portion of that.
Right. We can see patients that are in the nursing home and rehab also.
Okay.
You may have a patient that was discharged from the hospital with a wound or a complication, and they're going to rehab, but the surgeon maybe wants them to follow up with a wound center just in case.
Yeah.
You know, we could see that patient every couple of weeks just to make sure everything's going okay. So we can still see those patients in nursing homes and rehabs. Like I said, we do work with home health agencies, but we also want the patients to know that if they have a wound and they can't see their primary doctor or like for 2 or 3 weeks or 4 or 5 weeks because they can't get an appointment,
right.
then they need to find a wound care center somewhere. I mean,
Right.
It may not be Henry County, but they need to find a wound care center somewhere and see if they can be seen.
Right, yeah, because that's especially, you're especially looking at this specifically.
Right.
So I know you mentioned at home, when people are dealing with their wounds, they will come see you or they'll try to do it at home. And, you said people need a support system. So what if you're a family member of someone who's dealing with a wound and needs help dressing or cleaning, and you're the type of person who's maybe a little squeamish or kind of not really able to help them?
Well, it's hard to take care of your loved ones when they have a wound because you don't want to cause them pain. You want to help them, but then you're also not really trained in how to do that.
Yeah, you're not a nurse, you're not.
And so one of the things we can help with at the wound clinic is we can either help train you to do it so that you are
so you're
comfortable.
There. Yeah, you can come to the appointment.
Show you how to do it, give you the things that you need to do it with to make you comfortable. And then if you're not comfortable, we can have that patient just come in and let us do the dressing.
Right. So if you are someone who's like, look, I want to help my loved one, but this is just not something I'm capable of doing.
Right. It's, not everyone can pack a wound or pack gauze in the wound. They're not just comfortable doing that. So that's what we're here for. We're here to either show them how to get comfortable doing that or to take over that for them so that they don't have to do that.
Exactly. So do you have any advice for people at risk for developing chronic wounds? Like we said, with diabetes or poor circulation? I know you mentioned, don't wait too long to say anything, but are there any things that they could do to maybe prevent it, or any advice?
Probably the number one thing I could tell you for as we get older, and I say as we get older, or if you're diabetic or you have some kind of neuropathy or foot problems, is avoid cute shoes.
Oh.
I know that sounds terrible, but avoid cute shoes. You want very good, supportive athletic shoes. You do not want flat canvas type shoes that are not supportive. I know they're easy to get on and they're cheap and they're kind of comfortable, but they're not going to support your foot. And we see a lot of diabetics that come in and the shoe is the number one reason they developed a wound. It's not fitting correctly or it's not supporting them. And then that's why they get a wound. And probably the other recommendation I have is avoid any kind of tobacco or vaping. It's sad to see a patient not heal because of some kind of tobacco product.
Right.
And by the time the damage has been done to their circulation that they didn't even know was happening, because they didn't realize that smoking causes circulation issues, then they've already reached a point where it's difficult to heal their wound. And that's sad to see. And
is anything, I know there's like compression socks and things like that, to help with, especially, feet and ankles and things like that?
I would say that if you want to use compression socks, you need to make sure you check with your provider first.
Yeah,
there are different kinds of compression. There are different strengths of compression.
Right.
And if you don't wear the right strength, then it may not be helping you as much as you need.
And you obviously don't want it to be too tight. Especially,
right.
Because that's another circulation issue.
But if you have arterial issues, then you may need to avoid some type of compression.
Altogether,
so usually we use that with a venous disease, occasionally with arterial, if the doctor okays it, but the doctor has to. So
but a doctor would tell you, if this is recommended for you. So we can talk about how the Wound Healing Center has evolved over the years to meet patients' needs.
We have really tried to keep up with all of the new and evolving treatments that are out there. Like I said, we do a lot of antimicrobial type dressings to try to avoid infections, to try to keep patients from having to go on antibiotics. But we also offer a fluorescent imaging service at our clinic, which is, I describe it as a Star Trek kind of machine. It's just a little device that we shine a fluorescent light on your wound, and it can tell us if you have enough bacteria in your wound that will keep you from healing. Oh. So most of the time we have to do a culture to know that, and it takes about 3 to 5 days to come back. Yeah. This is a good way for us to flash it right away and know right then if something is preventing that wound from healing. Right. And we can show the patient the image, and so they can see, you know, you didn't look infected, but you really do have enough bacteria that's preventing you from healing.
Right. Is there anything you wish more people knew about the importance of wound care? I know there's a lot of maybe old ways of doing things that were maybe slower, sounded painful or something, and people kind of just get that in their head, and for the rest of their lives they're like, oh, you know, this is how it's going to be.
I just want patients to know that they don't have to live with a wound.
Right.
That
you have options.
Yes, you have options. Don't sit at home and wait for something to heal on its own. You know, when we were 16, we all healed fast. Mm-hmm. We all, you know, could put some peroxide on it and still heal. Yeah. But now we all need a little bit of help. And I just don't want patients to sit at home thinking that I'm going to heal this or it's eventually going to heal, and then something tragic happen where they didn't get the help that they needed. So that to me is important, that patients know that they have options. They can ask their doctor to go to a wound care center, or they can ask them if they can get a referral, or just pick up the phone and call us and see if they need a referral. Yeah,
it would be, I guess, a better safe than sorry type of deal. There's nothing embarrassing or wrong about just checking ahead of time, you know, to see.
And just to let them know that, you know, if they are in an area they can't reach our wound clinic, there are other wound clinics that maybe you could get to easier, but there is help out there for patients with wounds.
What would you say is the most rewarding part of working in this field? Because I know, you know, you said wound, ostomy, and continence. So that's WOC, because I've heard of WOC nurses.
WOCN.
Of that field for you.
Well, I love to see a wound come in and heal. I love to see a patient come in and they were scared, or they had an infection and they were in pain, and then the next visit they come in and they're already getting better and their wound is healing, and they're able to get out and work in their yard this summer or do what they need to do.
So you get to watch them on their journey.
Yes, I love to see that. And then I'm also the ostomy nurse for the hospital and for the clinic, and that's taking care of patients who have colostomies or urostomies or ileostomies. And I love helping those patients learn how to manage their ostomy at home.
Right.
It is a life-changing experience to have an ostomy, and being able to help them through that process is very rewarding for me.
Exactly. Right. Mm-hmm. So how can people learn more or make an appointment if they needed specialized wound care up in Henry County?
So at the Center for Wound Healing, you can call 731-644-8208 and ask for an appointment. And our clinic can tell you if you need a referral, or you can obviously ask your primary care physician.
Okay. Great. And I will be sharing this phone number and the address and everything of the Wound Healing Center in Paris in the show notes of this episode, so people can have that there as well. Is there anything else you'd like to share with us and to our listeners about the Wound Healing Center and its impact?
Well, I would like to say that our Center for Wound Healing, we have a very experienced staff, and I'm very proud of the staff that we have. Between our providers and all of our nurses, we have over 75 years of experience in wound care. So we have staff that has been working in wound care for a very long time and has lots of experience. Right. Patients come in and say, I bet you've never seen anything like this. And we have seen lots of different interesting types of wounds, and that's what we love to do.
Yeah. And that's a good thing, because it's like, this isn't the first one I've seen. So it's like comforting to say, oh, okay. Right. This isn't their first rodeo.
But that doesn't mean it's not important.
Right.
your wound, you may think your wound is small and it's very painful, and your wound is just as important as somebody with a large wound.
And yeah, it's personalized to the individual. Mm-hmm. Well, Sonya, thank you so much for coming in and sharing all about the Wound Healing Center there at in Henry County and giving us all this great information, and glad to have you on the show.
Thank you for having me.
Thank you so much. Mm-hmm. Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.